Chapter 2 also talks about drug compounding. So, drug compounding is the creation of a new drug. And when I say that, I mean that we are taking an existing drug and maybe changing its form, crushing it up and combining it with a liquid, administering it via saline in an IV solution, um, or flavoring something and giving it to an animal, or combining a couple of drugs in a syringe. And all of these are common practices in veterinary clinics, and there's some good reasons for that. Um, as I said back when we talked about FDA approval of drugs and the label uses, indications given for drugs, these are drugs get, when they're brought to market, they get researched for a particular use or uses. And in order to get the label indication for it, they have to do research. After a drug has been out on the market, sometimes we find new uses, and it's not always practical for the drug companies to go back and devote the resources to researching them, especially if the drug is relatively um, safe and uh, it, maybe other places, other institutions then go and do the research for them. For instance, a teaching hospital might do the research for the new use of a particular drug and um, and then put that out in published journals. So either the drug can be either for a labeled use or for off-labeled use. Just wanted to make that clear. Um, but there are some regulations regarding these new forms or new drugs that are created. It's somewhat controversial. Every once in a while, somebody in the regulatory arena questions this usage because some of these drugs may involve human medications and it might have an impact on those drugs. So just bear in mind that these regulations are somewhat in flux from time to time. They get questioned. But in general, the health community realizes that it is impractical to study every drug for every particular use, or a drug that might be formulated for humans that we're using for animals. We may have to change the form of that drug in order to have it be able to be administered to a different species. So some common practices that occur in clinics all the time are things like creating an anesthesia cocktail. So when we give a drug, drugs to induce anesthesia, so our goal in anesthesia is usually to put an animal on a gas anesthetic. And in order to do that, we need to reduce their consciousness enough so that we can put a tube down their throat, intubate them in order to deliver that gas. And in order to do that, it's usually um, an injectable drug to induce that level of anesthesia that will be very temporary just in order to get that tube down the throat. Mixing two drugs in a syringe together is not advised unless you know those two things, those two drugs are compatible with each other and won't change some properties of them that would make them so that you wouldn't be able to give them as an injectable drug. We dilute drugs in clinics with saline. We might give them in an IV bag, or we may combine a drug with a syrup to make it more palatable. Or these days, there are companies that have flavorings that you can get specifically for veterinary practices, and they have the exact instructions on how to how to dilute or combine them with those flavorings and give them to the animal. We make just crushed tablets and mix them with a liquid to form a slurry just to help get them into the animal as well. Um, but if an adverse reaction does occur, the clinic needs to know that there can be legal action taken because the clinic has created a new form of the drug. So most veterinarians will be doing things that have been, discussed in journals and have become common practice. Usually, most veterinarians are not going to be striking out on their own and creating new things. So that's a lot of responsibility to take. So some parts of these regulations are that we need to use this product within the practice. And we need to be sure that the benefit to the animal is greater than any health risk to the animal or public. And this is where most veterinarians are not going to strike out on their own. They're going to be doing things just within the clinic setting. And if they do have to send it home, there's some special regulations we're going to go over. But it should not go outside of the practice. It should just be these compounded drugs should be used within the practice. If there is a greater health risk to the general public, then that is not an appropriate use of compounding, regardless of whether it will save an individual animal's life or not. We have to put the public health above an individual animal's life. So we have to be very careful, as I said, to just use this within a clinic. You can't have, Dr. Joe's horse liniment that has just been created by Dr. Joe that he then sells outside of the practice. That is manufacturing a drug, and that is illegal. So if a veterinarian wants to do that, they should be working with a drug company in order to develop something for that purpose. They might be able to just do, a quick sort of thing to, form. In other words, usually mixing it with a flavoring or something like that to get into an individual animal that's within their practice. But they cannot then sell that as their own product. So, sorry, my slide didn't want to advance. So here are some further regulations that we need to bear in mind. It has to be compounded and dispensed under the direction of a veterinarian or a pharmacist. There has to be a veterinarian client and patient relationship in order to prescribe that drug for an animal. And we can't have violation of drug residues. So drug residues have to do with food animals in particular. And we have to know, I'm sorry, I'm going to go back. I'm progressing a little too fast. We have to know when we're dispensing this to food animals what we call the withdrawal time is. So a withdrawal time is that time from when an animal ends their time being given a particular drug to when they can go to market and enter the food chain. So it may be 2 weeks, it may be 4 weeks, but basically from when the end of the time an animal is administered a particular drug that the animal can go into the food chain, or their products, eggs, milk, honey, can go into the food chain. That product or meat has to be, or the animal cannot go to market in that time. So on the label, when we prescribe these drugs, we have to have the veterinarian's name and address, of course. We have to identify the animal, just like we would with any other prescription. We have to indicate what condition is being treated, and then we have to have the date the drug is dispensed and when the drug expires. And in the case of compounded drugs, that can't exceed the length of the treatment. Sometimes these drugs can, if an animal is being given a drug indefinitely for a particular condition, then the expiration date is going to be shorter than the length of treatment, and the owner will have to go back and get the drug compounded every couple of weeks or so. I've had this very experience myself with something that I was treating in my animals, and I had to go back every 2 weeks to get it compounded. So also the label has to have the medically active ingredients, the directions for use, any cautionary statements if they are applicable, and then lastly the withdrawal times if this is an animal that it itself or its products could enter the food chain.